guys, it's Heather. Again, same day, different trip this time. I just went to the grocery store and to Target. We did not have we could not find our heating pad, so my husband was having some gas pain, and so I went out again to get a heating pad. And I am going to be driving home from the grocery store. So it is still Saturday, and still the day my husband came home from the hospital from his DS. So, I think this is the last in the series of videos that I discussed on my first video, which is up already, thankfully. The second one's not up yet, but it will be before this one. So what does it matter? Why am I saying that? Anyway, so at WLFSA, they had Dr. Moya, a plastic surgeon, there, and he gave did one of the talks like really early in the morning, I think on the second day, on Saturday, and he described the procedure that he does, and he also did consultations pretty much all day, every day, for plastic surgery. So I saw him when I was there, and so he does what he calls the corset body lift, which is kind of like the fleur-de-lis tummy tuck, but also includes a cut at the top, sort of under your breasts area. Excuse me, I was eating a few potato chips. Side note, potatoes generally don't make me gassy. Grains like rice, corn, wheat more often do. Bad thing to know, but actually I can generally take or leave potatoes, so whatever. Anyway, so I saw Dr. Moya, and he told me what he thought he could do for me, and sadly, so for me, the three areas that I am most concerned about for plastic surgery are all pretty equal, as far as not like, oh, I really have to get this done first. I really, really want to get this done first. I really would love to get them all done at the same time, but is my stomach, my breasts, and my arms. But Dr. Moya won't do a breast lift with augmentation, which I need, at the same time as the corset body lift. He said one time when he did that, one of the patients had their implant migrate down below the incision into sort of the abdominal area, and so he won't do that anymore. Sounds like a great reason. And so, I guess I really don't want that to happen, so I really don't want that, but he says you should wait. He waits 9 months before he does that. So, he seemed very knowledgeable. I really liked him. He's in Pennsylvania, but his methods don't require drains, and he only requires you to stay there about 3, maybe 4 days after surgery, and then you can go home. And since you don't have drains or anything like that, then cool. I didn't discuss my breasts and my arms as much with him, although he would do those. He could do arms at the same time as stomach. Could do arms at the same time as breasts. That would kind of be up to me, but I got a quote for basically just the corset body lift. So there's that. And then Kristen at Asta Cielo y Mas had worked with Dr. Sauceda to arrange some consultations separate from WLFSA at his hotel. So I did that as well. I know my husband would not approve of me going to Mexico, and that's okay. I completely understand. And also, right now for me, I have 2 small children. One not quite in elementary school, he has another year, so he'll be in daycare, and the other will be going into 3rd grade next year. She just finished 2nd grade. So being in Mexico for 2 weeks Dr. Saucedo would do all of the procedures that I want all at once, even would do a thigh lift if I wanted. I don't care as much about that, and sort of, I think a small thigh lift, I just have, like, basically on the top inside of my thighs is the only bad area for me that I really care about. But I'd care less about my thighs. I probably would want them done at some point, but I don't care. So, he would do it all at once, but 2 weeks away from the kids, it's not really very feasible. 2 weeks in Mexico away from my kids at this point, it kind of makes me panic. I went on vacation for 2 weeks before I had kids. My husband and I went to France, and we spent like a week in Paris and a week traveling around the rest of France. And I took French in high school, so I speak French relatively well. I've lost a lot of my vocabulary, but I've been told I have a decent accent in France, not in Canada. Completely different beast in Canada. But so, and by the end of the 2 weeks, I wanted to be at home. So I understand why he wants you there for 2 weeks. Completely understandable. Lots of drains, lots of all that, but it just does not seem feasible for me. So right now, as far as the 2 people I've spoken to, I'm leaning towards Dr. Moya for at least the course of body lift. I really like the idea of that surgery. The scars don't bother me. It's a lot of scars because it's basically a capital I-shaped scar, below your breasts, around your groin, above your groin area, and then between them is what it ends up like. That's the way he does it. You should go on YouTube and see sort of how he does it. He has a few videos, not too bad, but anyway, and not like the whole long surgery, but you should go look at them, and look at his website. But so right now, if I had to choose between those 2, I would definitely go to Dr. Moya for the course of body lift. I need to make an appointment to see a plastic surgeon in my area. I want to probably see at least 2 in my area. I have one that I will definitely see, and then the other one I think is also the one that my doctor recommended. He said he recommended 2. The one that had a little seminar at their office, and I went to, and then the other one I think is the same one that Amy Princess Monster Trucks NC, I think is her handle here, recently had surgery with. I think it's the same one. I'm gonna verify, but so I'll probably see both of them, because he said there were 2 that he recommended for weight loss surgery patients, and I trust my surgeon, so hopefully he would not steer me wrong. Anyway, so right now, that would be my decision, but we'll see what happens when I speak to local surgeons. I really do like, I know I need at least a fleur-de-lis tummy tuck, and I know I need muscle repair, but so anyway, that's where that stands. My husband said basically, go ahead, schedule it with Dr. Moya, we'll do it in September. I'm not ready yet. I'm ready, but I'm not ready, Anyway, so that's the story with plastics currently, and I will update you guys when I have any more information, and hopefully you'll see videos from me. All right, take care. Bye.